least from our perspective, is she's got two major things going on. You. Number one, she has this lingering infection
Right.
with the MRSA
Yeah.
and something called VRE. Basically, she's got two different bad bugs.
Right.
And despite tons and tons of antibiotics, she still has this little abscess thing on her tummy.
Mm-hmm.
And it's been tough to treat. And her white count looks good, and if you look at, there's no other signs of infection
Yeah.
on her blood tests other than, it's still draining.
Yeah.
The other thing is that when we did the scan of her brain, she does have, trying to think to put it in, I have all the medical terms, but I'm trying to put it in English.
Mm-hmm.
She has signs of basically some brain injury.
Mm-hmm.
Like, it's kind of like people that have a stroke.
Yeah.
If you look at their brain after the stroke, they have these little changes. And that's kind of what we see when we look at her brain. Now, as far as I know, I don't know that she's ever had a stroke.
No, she didn't have any problems like that till she had the seizure over there. And
Right.
I'm just trying to figure out, did that cause a seizure cause her
It's
to have
possible because when we look at the brain, it definitely looks not normal
that? Mm-hmm.
on the MRI. And they called it like Wernicke-Korsakoff syndrome, but even though it looks like that, I don't think that's the answer, because basically what Wernicke-Korsakoff is, that's what we see in the brains of alcoholics.
Mm-hmm.
And she's not an alcoholic.
Right.
Not that I know of. I wouldn't think so. She's a Bible-believing, happy Christian.
Yeah.
So, but that's what her scan looks like. But we also see that in other people that have brain injury.
Mm-hmm.
So we see that in people that have thiamine deficiency and vitamin B deficiency and vitamin B12 deficiency. And we see that in people who have a lot of malnourishment.
Mm-hmm.
And that is the case for her. She had that surgery
Yeah.
where they rerouted her stomach and she's lost a bunch of weight, I guess.
Right.
The problem is she's basically malnourished.
Mm-hmm.
So we've had her on this TPN now for a long time, trying to get her protein levels up and her nutrition up. We're giving her thiamine, we're giving her B12, we're giving her folic acid, we're giving her all that stuff to try to tune her up.
Mm-hmm.
Here's our dilemma. She can't live on that.
Right.
You can't go home with that. And even though that's like basically a steak and eggs in a bag,
Yeah.
and all the nutrition you'd ever need, there's risk with it. So it's high protein. The risk of staying on that TPN is the number one side effect of that TPN is getting an infection.
Yeah.
And we're already fighting an infection.
Mm-hmm.
So, but we can't not give it to her because she's already so malnourished that I don't think she would survive without nutrition. So we're hitting this roadblock.
So why do you think her stomach is rejecting food? I mean, when she tries to eat,
Yeah.
why do you think that is?
In part from this infection. It's like she's got this catch-22. She can't eat because she doesn't feel good. She doesn't feel good because she can't eat, and she just can't get ahead. So we're hoping that if we can restore her nutrition, treat the infection, that she would start feeling better and she'd be able to tolerate her food and eat better. That's our goal, is to try to get her eating again.
So how long do you think that would take from this day?
From this day forward, she could start eating any day. She's been on that long enough
Yeah.
that I would think her body would be starting to recover. Let me give you some numbers. There's something we measure called a prealbumin. And a normal prealbumin is between 10 and 20, right?
Mhm.
And that's a measurement of some person's body protein. And essentially, it's a snapshot of their health, nutrition-wise. Her prealbumin was down to 3.5.
Mm-hmm.
And it needs to be at least 20, but it really needs to be about 30 to heal. When you have a wound or you have an infection, we try to get the prealbumin up to 30, and hers was at 3.
Mm-hmm.
So we're pushing all the protein we can push that's safe for her. So our hope is that if we get her body restored a little bit, her appetite will return. She'll be able to eat better. She won't be nauseated. And then we can move on, move forward.
Mm-hmm.
Because we can't put a tube in her nose because of all her surgery. She can't have a peg tube because of all her surgery.
Mm-hmm.
So we're stuck with this for now. Now, if we get to where we think this is a danger and she's too high of a risk for infection and this isn't working anymore, we could send her over to St. Anthony's.
Mm-hmm.
They have interventional radiology doctor who could put a tube down her nose with a CAT scan.
Right.
In other words, they have to see where it's going. They have her in the CAT scan machine. They advance the tube slowly. They look at the machine. They make sure it's in the right place, and then they can safely get a tube down her nose.
Right.
But that's not. You don't want to live that way either.
Mm-hmm.
You know, that's still temporary. Our big goal is to get her eating again.
So do you think if she gets all the nourishment up, that would help her memory?
I'm hoping it will help her memory. We'll probably want to repeat a scan and see if her brain looks any better.
Mm-hmm.
I'm not sure when the best time to do that is. If you do it too soon, it just looks the same, and so you kind of want to give her enough time.
When was the last time you did
This brain scan? It's probably been a couple weeks.
They took her for a CAT scan of her stomach.
Yeah.
Is that?
Yeah, we got those results back and everything looked okay.
Mm-hmm.
What we were worried about on that is, you know how she got drainage here?
Right.
Well, the nurses thought she may have been having drainage down here.
Mm-hmm.
And we were worried that she had a fistula, like a track that connected from this infection down out the vagina.
Right.
So we did a CAT scan, but there was no fistula.
Mm-hmm.
She does have still that little bit of infection right there where that dressing is,
Mm-hmm.
but that's it. So that was good news. So we got good news on the CAT scan. And good news on your blood test. Her ammonia level is normal. All the blood tests we did this morning were good.
Mm-hmm.
It's just her protein levels are still low. She's still kind of confused.
Yeah.
She still has this brain thing going on. You can see she has some brain injury because her eyes. Have you noticed her eyes kind of twitchy?
Yeah.
We only see that in brain injury patients.
Yeah. See, she started that over at Select, and when it was all buck-eyed, and you know what I'm saying,
And maybe it started with her seizure. I don't know if
Yeah.
that's when it started.
well, yeah, that it is. It was July the 29th.
Yeah.
That's when they called me about it.
If a seizure lasts too long, it can cause some brain injury.
Yeah.
So, so our goals right now are to restore her nutrition and to treat her infection, hoping that she'll wake up, her memory will improve, and she can start eating again.
Mm-hmm.
It's hard to say. It's hard to put a day on that. How long will that take?
Yeah.
You know, a week, 2 weeks, 3 weeks? I don't know. But it seems like all the other things we're watching are going well. In other words, if she's going backwards and backwards and backwards, we'd probably have to ship her back to St. Anthony's.
Mm-hmm.
But she's doing well, except for those couple of issues. Does that make sense?
Yeah.
So I probably need to repeat her brain scan, maybe like on Monday,
Mm-hmm.
and see where we're at, see what it looks like. They said, I don't think it was yesterday, it was the day before, LaToya said she was eating a little better. I haven't heard yet how she did yet last night.
Well, I gave her some oatmeal today. I thought maybe, for a while I would bring her something, give her 2 or 3 spoonfuls or whatever, and then stop. And then she would do okay. But I gave her some oatmeal and eggs, and about 30, 45 minutes, she threw that up.
Unfortunately, part of the problem is her old surgery. When they rerouted everything and they redid her surgery, her stomach is not very big. So normally a person, they'd get over this faster, but because of her surgery, it kind of hinders her stomach and stuff. I mean, you did the surgery for the right reasons back then, and it was probably fine, but now it's causing you some issues. It's not that the surgeon did anything wrong, it's just that it's kind of making it more complicated to treat you.